EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor. Good afternoon, and welcome to Community Conversations. As those of you that tune in regularly to my program know, our conversations are unique. They are non-political. They're all about people in the neighborhood of Indian River County and beyond that have something to do with, I know you're waiting to see if I'll say healthcare, but really the wonderful community that we live in. And many of them are nonprofits that add to the uniqueness of our community and to the joy of our community. And today is no different. Today I have Carrie Lester and her COO, David Flint. And I would have normally said from the Substance Awareness Center, but one of the things we're going to talk about is they are rebranding as Thrive. So welcome.
Thank you, Vicki. That is correct. This is an exciting time. It's a bold new move for our organization, but we are stepping into a new chapter after 35 years of service.
Wow. So the thing of it is, the Substance Awareness Center is not changing the development of programs or existing things, but rather a new perspective.
Absolutely, absolutely. You know, we talk a lot about how language matters. We look at what's stigmatizing and stigmatizing language. And so when we embarked on this journey of, okay, what have we done in the past 35 years? And we've had a couple of name changes around substance over the past 35 years. We felt like it was time to really rebrand and step into a new chapter. And so we did a lot of work to land on a new name for our organization. David was a big part of a lot of those conversations. We had the team working together, and really the question was, what is it that we want for our community? What is it we want for the youth and the children and the families we serve, and for the adults we serve with substance use disorders? And so we landed on Thrive.
Right. So were there other things under consideration in those discussions, just out of curiosity?
I think Thrive came very organically through our conversations. I don't know if you want to chime in on that at all, David.
So the thought process was first and foremost knowing that, you know, we needed help with this. And so we partnered with Ironside Press here in town.
Okay.
Little plug for them for the rebranding
They help
services.
many of us.
Yeah, they're great. And whether we were going to use an acronym, keep SAC, or change to something new just became very evident through the conversations that we were taken through in that journey. Just really discovering who we are and what our ethos is. Thrive just became very evident that that is our goal.
I was going to say, it's definitely been your mission, is to help people thrive, regardless of where they're at the current spot in their life, to become something better.
Yeah. And for me, it was really when one of our team members kind of shouted out the word Thrive, and we all just kind of took a pause and we were like, yes, that's it. You know, for me, it was really when I look across all of what we do. I mean, we truly, with our coalition work, as we mobilize our community, we want to see this community thrive. We put those evidence-based practices in place. We are convener so that our community thrives. We put evidence-based prevention in place for our youth. We work with their families so that they thrive. And then obviously our treatment programs. We don't want people with substance use disorders to just survive. We want them in recovery thriving. So to me, it was like a fit across all of our programs.
Well said. I have to say, you've been practicing this rebranding speech. So for someone who's not familiar with your organization, despite 30-some years here, we have a lot of people that are new to town that have come in to support their parents because they've heard this is paradise, or for a variety of other reasons. So if they're not familiar, do you want to give us a little bit of a thimbleful of information of your various programs?
Yep. And so part of the work, you know, people who are familiar with us know I talk a lot about prevention works and recovery works, and that those are still our two main programs that we do when we serve in our community. But in this rebrand, we really are leaning into mission pillars. And so we've got the mission pillar, thought leadership. We've been in this community serving for 35 years. We have a lot of expertise experts on our staff. And so we really are the thought leaders in our community when it comes to prevention and substance abuse treatment. So that's one of our mission pillars, and I can talk more about that. We lean into education. For those who are familiar and for those who aren't, we really lean into evidence-based prevention education, whether it's for our youth or even now our older adults with our WISE program. And so evidence-based education is really important in a piece of our mission pillars.
And WISE is something I hadn't heard before, so we're going to come back to
We'll
it.
circle back to that one. Our other mission pillar is community awareness. And so I talked about mobilizing our community, our prevention coalition. We are all about making sure that we have that awareness out there. And so we've got our community awareness.
Is that where SAFER comes in?
That's where, and that will be our Thrive Prevention Coalition. So we will all, everything that we do will fall under the auspices of Thrive, and using just one single name to describe what we're trying to achieve. Okay. So we have our community awareness, and we have our help. We offer help to adolescents, early intervention and adolescent treatment. And then we have our healing, that's our adult recovery programs, our recovery with results. And so those are the mission pillars all of our different programs fall into, and the work that we do through the community, through youth, families, and adults with substance use.
So on the healing side, you are the overseer of sorts to two community-based homes. Mm-hmm. So could you tell us a little bit more about that?
Yes. So the homes that Vicki's referring to are our recovery assistance homes. And so those are FAR certified, Florida Association of Recovery Residences. Those are certified homes where people with substance use disorders, right now we serve men in both of our homes, they can come and they can stay for the amount of time that they need to really launch themselves into independent living and long-term recovery. And David does a lot of work in the operations side of those homes and working with our peers that provide the support services, if you want to speak a little to that.
I'm sure. So the houses are really set up family style.
Okay.
We have a limit of 6 individuals per house. Our peer team, we have a RAP manager who meets with the team, the residents on a regular basis. And it's just a phenomenal environment that they're in, with the opportunity to receive the services through day treatment or outpatient treatment, partnering with other nonprofits in the community for volunteering, for work skills and things like that. We're able to support them on their journey to thrive.
Nice. You're just working right in there. But the reality is that a lot of people don't understand the need. I guess they used to be called sober houses. Mm-hmm. Okay. Because they think, okay, you've had the treatment, you've had detox, you're on meds. What's the problem? Why do they need a place where they can all gather?
Well, a lot of that, and that's where our peer support really comes in. And those peers have that lived experience. And so they're able to relate to what the residents are going through. But as you're, especially early in recovery, or if you're coming out of a situation of incarceration and, facing homelessness, the risk factors of recidivism in either reoffending, going back to jail, or getting back into substance misuse is very high. And so in a small family style environment where our peers are able to have regular interaction, we're able to provide the support that really helps prevent the relapse, provides the support. It takes quite a bit of time for the brain to start working in that recovery
new
mindset.
Pathways.
Exactly.
Absolutely.
Okay. Otherwise, it's like the knee jerk. It's not a question of they weren't strong enough, or the detox didn't work, or the medication's not right. It's really that time to reorganize mentally, and it can't be pushed.
It really, we're looking at how do we re-engage that frontal lobe. That, in addiction, it is really the most primitive part of the brain that's operating, that reward pathway and that reward center. And so we've got to build those pathways, reconnect that frontal lobe for our residents. And it just takes time. These homes are near and dear to my heart because they really set the foundation for long-term recovery. It is really about the family environment. It's learning how to, those interpersonal relationships. both positively and the challenging side of that. Get the support from the family with which they're living, but also some of the emotional triggers that might happen in that home, and to be able to experience them in a safe place, work through them so that when they're out navigating in the world, whether it's the workplace, back in their own families or new relationships, they have the skills to do that effectively without resorting back to old habits and behaviors.
And is that something that they help support? I mean, some of these folks are working, some are not yet. I know people are wondering about the economics of that.
And so really our philosophy is, in the beginning, is we want people to get settled into the program to build their recovery support. And then there is some fees that are incurred over a period of time while they're in the program.
Yeah, the first 2 months are vital. Really, the first 90 days are vital. But those first 60, getting acclimated to, being out of incarceration, if that's what it is, being in this new environment.
Oftentimes it is, because that's the turning point for many folks. It's like, how did I get here in my life?
Yeah. And so it's really about how do we stabilize them and remove the barriers.
Okay.
And so there's not a stressor or a pressure of, I got to get back to work.
Right.
It's really about what is it that you need. And so we can really build a plan for people individually.
Okay. Skill building in a lot of different ways.
Absolutely.
Because I'm guessing that some of these folks have struggled for quite a while and maybe have lost out on some of the technical skill building, whether it's retail sales or carpentry or whatever it is. They've probably not been a regular person in the workforce for some time.
Yeah. And I feel like, there's two populations we work with. Some people we're rehabilitating. We're rehabilitating that brain. That frontal lobe has been developed. They have skills, and we're really rehabilitating them back. And for other people, we're habilitating. I mean, when you think about the age of onset of use, you really stop growing and maturing. And, that's a time of the frontal lobe development is adolescence. And if our onset of use is in early adolescence, there's a lot of times our work is really to habilitate that brain and those skills back into society. So we've got to give them the time they need.
Yeah. And I appreciate spending this time on it, because I do get some eye rolls. I never call them sober houses anymore, but, that the perception is still that these folks are, I don't want them in my neighborhood. They're no good. They're gonna go back in jail. They're losers. And that's farthest from the truth. These are men and women, in some cases, not yours, but in other places, that are really doing hard work. It doesn't look like it because it's all self-contained and they don't express that. Yeah. Or if they do, it comes out sideways sometimes.
And the ones in our program, they're living responsibly. They are, integrating themselves back into a life in recovery. And so, like David said, they're operating as a family. They fit very well in the neighborhoods with which they're in. And,
we've learned
vital.
so much about brain chemistry over the last 15, 20 years. It's a brain disease, addiction is. And, it doesn't have anything to do with you as a person per se, other than the way your brain reorganizes itself as a result of the drug usage or alcohol.
And it takes time to stabilize that brain, and that's really where our mission pillar to heal comes in, and we're really healing those brains, restructuring and stabilizing.
And you did all of this before your needs assessment that you all just completed. Do you want to talk to us after break about that a little bit?
Absolutely.
Okay, sounds good. Don't go too far away. We've got a word from a few sponsors, and then when we come back, we'll talk about the most recent needs assessment that's been done on this population. Thank you. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
If you dream of creating a home that embodies sophisticated island living, visit Sunshine Furniture during our Tommy Bahama Home for the Holiday sale. Bedroom, living and dining room, home office, media, and occasional pieces, Tommy Bahama Furniture is distinctive and unique, yet inviting and comfortable, and is all on sale now. We're also having a huge Black Friday closeout sale on patio furniture, indoor sofas, chairs, occasional tables, and dining sets from Berlin Garden, Windward, Telescope, Lloyd Flanders, Four Seasons, Capri, Universal, and more. Also, all pictures, lamps, and accessories are half price, and don't forget to visit our outlet and sales center across the street. Sunshine Furniture, 1295 US 1 in Vero Beach, next to Planet Fitness. Visit our website at sunshinefurniturecasual.com and hurry in today for our Black Friday savings.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine.
Blue Dolphin Pools strives to provide quality service with a well-trained staff in the field and in the office. They want you to know that your pool or spa investment means much more to them than just another account. They believe you have entrusted them with your investment, and they'll do their best to see that it stays in top condition. Blue Dolphin Pool has been in business over 35 years, setting them apart from the competition. Residential or commercial, Blue Dolphin will keep you in the swim. 567-5853.
And welcome back to Community Conversations. If you're just joining, you probably recognize my voice, Vicki Soule from Treasure Coast Community Health, where we provide primary care for all ages, all races, all areas of Indian River County. And we have all of our own employees, so there's no finger pointing. We take complete responsibility and the joy of providing primary care for you, whether it's medical, dental, behavioral health, pharmaceuticals. We coordinate and collaborate with a number of community partners, including what you all used to know as SAC, the Substance Awareness Center. But Carrie Lester is here today with her COO, David Flint, to talk about their new name, Thrive. So welcome back.
Thank you.
So we said before the break that we would talk a little bit more. So I'm going to open up the venue for you.
So we mentioned the needs assessment.
Yes,
and so we've been talking a little bit about our rebrand. We are now Thrive, and we talked about our mission pillars. And so when we think about that thought leadership, we have stepped into the space of convening a community needs assessment when it comes to opioid and substance use disorders. And so we've worked over the past year to conduct that needs assessment in collaboration with CARE-CG and with the support of the county commissioners, our local opioid settlement funds. We were able to do this work.
And that survey, I think, was rather unique in that you not only touched a number of providers of the care, but also the recipients of the care. When we received the funding to do this needs assessment, first and foremost to me was we need to hear the voice of those most impacted by the opioid epidemic and those with substance use disorders. And so it was really important that we convened people with lived experience, as well as their families, as well as the service providers to get their perspective. And so we conducted focus groups. And so we met with over 100 individuals with that lived experience side or that service provision side to glean insight into the unique challenges in our community. And we used that information to inform a community-wide survey. And we had over 400 responses on our community-wide survey. We exceeded our target. And so that gave us a 95% confidence interval that the results from this needs assessment are translatable to our community at large. And so the information, some of it is eye-opening, some of it we kind of know being in the field, but it will really help us steer a plan and helps us see the immense need that we have in this community. 88% of the respondents said they knew someone who has used substances in a harmful way. Wow.
And so
That's
nationally, it's a lot of people. Nationally, it's about 1 in 2. 50% of Americans have a family member or a close friend who has struggled. And so the wording was a little bit different on our survey, but 88%, it tells us that there's a lot of need and a lot of people.
So Southern Living may not call us paradise if they look under the covers, eh? But that is part of, I think, what happens This is a vacation town. People come here often because of our reputation of being a wonderful place. You know, go to the beach, have a Mai Tai, have a 4 o'clock or 5 o'clock cocktail before you go out to the art museum happenings or the theater. You know, we do have wonderful things, but alcohol is certainly a part of that.
Yep.
And your survey found that cocaine was right up there with it.
Alcohol, cocaine, and opioids were cited as among the top 3 in that survey. And so we know stimulant use disorders are on the rise. We see them here. We see more stimulant use disorders come through our doors than we do opioid use disorders in our service provision. A lot of them are co-occurring, and obviously alcohol is the number one problem identified in our community, and we see that coming through our doors also.
And opioids were a tremendous problem pre-COVID. Because our providers didn't know any better. They thought they were helping people with pain issues. They didn't realize how addictive it was. And then all eyes seemed to focus on Florida and opioids. And so a lot of education, a lot of conversion of alternate means of coping with pain started happening. So I think that may possibly have decreased the use of opioid, the misuse then that comes from that. But alcohol seems to be freely flowing.
Yeah, and I will say anecdotally, there was an epidemiologist working the cases among the overdose cases among the Treasure Coast, and he did spotlight that the decedents in Indian River County had high levels of alcohol and marijuana, along with the opiates in their system when looking at those overdose deaths. And for us, we know fentanyl is driving the overdoses nationally. We are in a crisis when it comes to overdose deaths. They have
the One Pill Can Kill campaign.
Absolutely. You know, fentanyl is, can be pressed into illicit pills. It can be cut into cocaine or methamphetamine, or it can be just sought after directly on the streets. And so our survey did reveal in our community that the good news is over time, Florida statewide overdose averages have decreased, but in Indian River County, ours have increased, and ours do supersede that of Florida statewide. And so that will be a key focus for our community and for this action group that'll form out of this needs assessment to address moving forward.
So your group really has their work cut out for them, for us. For the benefit of all of us in numerous avenues. And so in addition to changing your name, you're also increasing your location. We've got about 2 more minutes to talk about that.
We are. Early 2025, we'll be moving into a new location, and I'll let David tell you a little bit about that location. Just as a reminder, we've been in the community serving for 35 years, and when I started almost 20 years ago, we didn't do any recovery programming, and so the need has grown. The services we provide under treatment and those needs have grown, and so we are moving into a larger space that will transform the way we do service delivery. And David, you want to talk a little bit about that space for us?
Certainly. Currently, we are in 4 different buildings, 3 of them fairly close together, one within walking distance, but it does make it a little disjointed, especially when it's raining or in the middle of the summer, for us to get together and really work collaboratively. Our new space will have us all under one roof, working collaboratively and just being able to serve clients in a much more efficient manner. 2300 Fifth Avenue is the address we're moving to. Information on the website and forthcoming, but we are so excited to be able to see this new level of service reaching our community starting in early 2025.
It will truly transform the service delivery. I am so excited for our clients to walk through the doors of Thrive, to be able to thrive and not be on top of one another. We have dedicated group spaces. It will be phenomenal to meet the need.
That is awesome. So just to backstep just a little bit, when you move, what will the age beginning for treatment be?
So we'll continue to do our prevention programs. We serve youth 10 to 17 in our prevention programming, our adolescent treatment. If we find someone in prevention who meets substance use disorder, we will treat them all the way through adulthood.
That's wonderful. Because again, the emphasis is on catching things early.
Absolutely.
And so it's great to know you're on that forefront.
Yes.
Thank you both so much for being here.
Thank you
I
for
can't tell
having
you,
us.
I'm very excited for you too. We have collaborated for a number of years, and I can see just more good things going forward. So thank you too for being with us to the very end of our broadcast, and I hope that you'll be here next week as well. Take care.